My name is Maria Allenson. Thank you for joining us. Today's session will provide some insights on patient confidentiality. I would like to introduce you to Hussam, a gentleman who comes into the community pharmacy to collect his wife's newly prescribed medication. Both Hussam and his wife Judy are regular customers and are known to the pharmacist, God's Gift. However, this time, Hussam asks God's Gift about his wife's condition and medication.
Hello, God's Gift. I've come to collect my wife's medication.
Oh, hello, Hussam. It's good to see you. I hope you're keeping well.
I'm okay, but I'm a bit worried about my wife. I was hoping I could speak to you about her and this new medicine she's been started on. You see, I wasn't at the doctor's surgery with her, so I don't really understand what's going on. She tells me that she's okay, but she's definitely not herself. And now she's been started on this new treatment. Can you tell me what the medicine is for?
Have you had a chat with her about this?
No, I haven't actually.
The facts of the issue at hand are: a husband is asking the family pharmacist about the condition his wife is suffering from and her medications. The wife is unaware of this inquiry, and the husband has not asked for her consent to inquire. If we consider the ethical parameters of the issue, the principle of respect for patient autonomy, including the all-important sub-principle of respect for patient confidentiality, is the main ethical concern in this scenario. Confidentiality is directly related to respect for individual autonomy, which means that the patient has the freedom to control their own life. Respecting individual autonomy, therefore, means enabling patients to be in control of their medical treatment, including who they choose to disclose information about to. Another parameter of ethical concern is business ethics. In addition to provision of healthcare, the pharmacist also has a business-oriented relationship both with the husband and his wife to maintain. Future custom with them both may depend on how she handles this scenario. The pharmacist must not, however, compromise ethical practice for the sake of maintaining this financial interest in their custom. There's also a risk that she would be seen as uncaring or mistrusting if she doesn't disclose Judy's condition to her husband. Her reputation as a pharmacist would be damaged, however, if she breached confidentiality and did disclose the information. Breaching Judy's confidentiality could affect her reputation on a personal level within her business and also be seen as a reflection on the reputation of the profession. In essence, she could be regarded as bringing the profession into disrepute if she breaches confidentiality. There are also legal parameters to consider. In most countries, contemporary regulations include the prohibition of breaching patient privacy, and privacy laws are strictly abided by in healthcare in particular. There may, though, be times when it is appropriate to disclose confidential information. For example, if you have to disclose by law, if you should do so in the public interest, and if you must do so in the vital interests of a person receiving treatment or care. For example, if a patient needs immediate, urgent medical attention. There are a number of values to consider in this scenario also. Trust is an important value at the heart of confidentiality. A person may be reluctant to ask for advice or provide information if they believe that the pharmacist may not keep the information confidential. Compassion is also important in this scenario. The husband is obviously upset and very worried about his wife. The pharmacist must act with empathy and compassion whilst maintaining confidentiality. So what are the options open to the pharmacist? Option 1 would be for the pharmacist not to disclose Judy's condition without her consent, but to communicate in a professional, respectful manner. She could offer to call Judy or ask Hussam to discuss with his wife. The implication of this is that the pharmacist maintains trust and respects the patient's right to confidentiality. At the same time, the husband is treated with respect. Option 2 would be to breach confidentiality and explain to the husband the condition and treatment without Judy's consent, or even just point him to an internet source. The implication here would be that a breach of confidentiality may have both ethical and legal implications. Even pointing him to a readily available source is indicative of breaching trust and confidentiality.
I can see that this is very worrying for you, Sam. I'm afraid I'm bound by a duty of confidentiality. So this means that I can't discuss a patient medication with another person without their consent, even if that other person is their husband. Perhaps when you get home, you could let Judy know how worried you are and ask her about her new medicine then. I can help you understand the situation if she's happy for me to disclose. Would you prefer a call to ask for consent to discuss her condition with you?
Sure, please call her.
As you can see in this scenario, the pharmacist has both an ethical and legal duty to maintain confidentiality. As a reminder, this duty to maintain confidentiality applies in many situations. It applies to information about a person's medication, both prescribed and non-prescribed. It applies to personal details and other information about a person's medical history, treatment, or care that could identify them. It even applies to information that people share that is not strictly medical in nature, but that the person disclosing it would expect to be kept confidential. What would you do in this situation?